Good evening. This is Eugene Chan on Straight Talk. Our guest this evening is the Commissioner for Primary Healthcare, Dr. Stephen Pang. Dr. Pang is a specialist in geriatric medicine and the president of the Hong Kong College of Community Medicine. He is also a clinical associate professor at the University of Hong Kong. He has over 15 years of executive experience in healthcare management and was a member of the Elderly Commission. Welcome, Stephen.
Hi, Eugene. Thank you so much.
Pleasure. The Chief Executive announced in his maiden policy address that the government would publish a primary healthcare blueprint to revamp the current healthcare system. And you were appointed as our first Commissioner for Primary Healthcare in November, followed by the release of the blueprint in December. So perhaps you can tell the viewers, which I'm sure many are interested what this is all about, that and how it is different from the traditional treatment-based system that we had.
Oh, thank you. Primary healthcare system is a system that most people should first reach, and as a first context before they reach any health services. That's the best way that the people can get the health advice and also start some preventive care, and then have the disease screening as well as the early detection of disease. In many countries, I understand they start the development of hospitals and specialist care at the very beginning. But with the people find that there are more evidence that more interventions can be started as early as possible to keep people healthy, and especially the lifestyle modification which need people's involvement and participation. So health system in many Western countries is already mature and well developed in terms of system as well as the training in doctors as well as the other health and other nursing professionals. Mm-hmm. So that's why Hong Kong, we find that with aging population, this primary healthcare system is quite imminent that we need to catch up and then to coordinate, make it more systematic.
Right. Dr. Pang, I think I get your message saying that it is the first step that everybody should have. Screening, prevention, I think this is what you're trying to tell me.
Right.
But why do we still have to promote primary healthcare where Hong Kong is quite well known, at least in Asia, if not the rest of the world, that we have a very well established healthcare system with first-class hospitals and very well-trained doctors from all over the world. I think we're quite renowned on being a member of the profession. Everywhere you go, I mean, Hong Kong academics are very well respected. Why do we still need that?
Yeah, this is called health-seeking behavior. In the past decades, the government spent a lot of investment in the secondary and tertiary care. So we see the people would like to see specialists and also go to hospitals whenever they have sick. But the problem is that when they go to see specialists, they will they usually have symptom signs and even have a complication of diseases. And the people use this style of the health-seeking behavior, make them think that they only see doctors when they are sick. But the problem is they should seek advice and take up the more preventive care to make them healthy, especially when they get older and older. You know, the people need to enjoy the quality of life instead of just have a prolonged life. You can imagine people, when they don't understand whether they have any risk of disease and they find that it's too late to go to the specialist. So that's why we need to build a system to allow people to access to the preventive care and also have the right knowledge about intervention like vaccination, cancer screening, as well as the chronic disease screening.
Right, Dr. Pang, you mentioned the word aging. I'm sure all of us feel that the whole population, not just Hong Kong, the rest of the world is increasing in terms of aging population. That means likely to have more chronic diseases.
Yeah, right.
And I think everybody wants to have better quality of life when they actually get older, not being suffering all the time. And that's the reason why you said prevention is the right way to go. Before we go any further, I think the first question, our viewers are very sophisticated, going to say, is this going to increase our overall public health care expenditure? Because Hong Kong will spend a lot of money recently for very good reasons. We heard that our bank balance, the two, is really dropping. Hopefully our income will come again when everything goes back to normal. But why are we extra burning our system when we already have so-called very high healthcare bill that all of us have to pay? Is it worth it?
Yeah, this is the point why we need to set up a new commission on primary health care. You know, Hong Kong has a lot of services at the primary health level, but the problem is they are scattered. And you would find that you find difficult to find information, and also sometimes don't know where you can access to this primary care. In the current system, the primary care in Hong Kong, like primary GP, and some of them take up the role of family doctors. But they find that in the current system, they just see the episodic illnesses rather than can do a lot of continuous care. So what we try to work on is that whether we have some need to consolidate the resources that we have at the moment. Like in the Department of Health, we need to look at whether we can improve some services through purchasing the services in the community.
Right.
So that's the current practices of private doctors, or some of them even perform the family doctor's role, can be more, systematic, and some sort of people can have easy access to them at the affordable prices. And it's better also have a habit that we need to tell people that the health should be shared, like co-care programs with the government and as well as the healthcare professionals.
Dr. Pang, I must ask you another question before you. Sure. I'm sure you are very committed to make this happen. But I want to say, as I said on Straight Talk, I'll ask you a very straightforward question, because a lot of you have said, let's be more direct. Our government has been trying to do many things in the past, and we really appreciate the intention. But we found that private sectors tend to be more cost-effective and more efficient in delivering this. Will this be an area of work that you would involve more of the private sector? Because since you say you want to refer the patients to primary care, unfortunately, I have to say, there are many doctors in practice. They have the existing clientele. You're telling me I'm helping you to promote my patient going to see the other doctors. So how are you going to work with the private doctors?
Yeah, that's why we need to work in the two ways. One is the set of the primary care model, what kind of model we need to set up. Second is how we can work with the current public health system. At the moment, we have some programs already implemented, like the public-private partnership programs at the specialist level and secondary care level. But the issue is whether we can have more on the preventive care and the primary care level. So that's why we have a strategic purchasing office under both hospital authority as well as primary care commission. So we work together to see what sort of model we can have better purchasing through the private sectors. And also we know that 70% of the primary care consultation actually happen in the private sectors. So we try to see whether the private sector can take a more role as a continuous care. So the system design is to try to facilitate and encourage the private sector to look after patient in the longer terms and build a longer relationship. So
in other words, actually you're transferring more patients to the private sector rather than the public system.
I cannot say this transfer because at the moment the public hospital mainly take up more than 1 to 2 million population as a disease because they have disease and illness. But do you think about how about the other 5 millions? Whether they have a preventive care undergoing every day for them, like doing the more exercise, lifestyle modification, and have
so basically you're saying you're anticipating those who haven't been needing treatment, making sure they don't really need it at the end of the day.
Because we know as population get aging, there are more and more chronic disease happen because it's unavoidable. If you keep the current system, there will be much more people who see the public hospitals when they got sick. Yeah.
So with this primary care healthcare system, is it just the usual medical doctors we have to see? Is there any other fields of healthcare profession that it will be promoted?
Yeah, that's right. So we try to build two streams of the in the system. First is family doctor for all, and then they will have also try to develop more district health district health.
So
network.
all Western medicine.
No, district health network means they involve all the health professionals who have primary care and development, and also want to work with them in a coordinated approach. So that's why, like the district center, can coordinate, say whether there will be a network built with the other professionals like dentists, Chinese medical practitioners, as well as allied health and nursing. So this is we call multidisciplinary approach. Just because the family doctors or family medicine is quite well established in some countries. So we try to explore whether this system can be started first.
Right. So you're saying that this healthcare promotion is not just looking at coming from the Western medical doctors, from Chinese medicine, even with dentistry. One thing I want to ask you about the blueprint, before you tell me more about it, I want to ask you, you've been trying to to push this, make sure we understand the importance of prevention. But in Hong Kong, we have one of the highest life expectancy in the world. So how is this primary health care going to help me, for example, by supporting it? How is it going to help my health?
Yeah. Yes, we have a very long life, but as our Secretary for Health said, we really want them to live with quality health, quality life. So in order to have a life with a very good health, then we need to start the preventive care as early as possible. So many countries, they start the very strong intervention for those age over 30 and 40, because every age they have their something they have to do. Like for women about 25 years of age, they need to have cervical cancer screening. And for those over age 45, they start the diabetes screening. So those work, they need to start as early as possible.
When you said prevention, I just think of when you say Chinese medicine or even in the dental profession. The both profession promote sort of, treatment, actual work before actual treatment is needed, more prevention.
So dentist is a very successful case. We can see when every kids and children, they start to brush their teeth, right? Then this is sort of prevention. So dentists can also give preventive care to those people of any age. Right,
Dr. Pang, let's go to a break now, but viewers, don't go away. We will be right back with more interesting points coming up. Welcome back. We have been talking with Dr. Stephen Pang about the government's blueprint for primary health care, why it is important to implement this strategy in Hong Kong, and how it will provide healthcare services to our citizens. So, Dr. Pang, in the first half, you have stressed the importance of prevention, and you mentioned the good work by the dental profession or even the Chinese medical practitioners, that they have a different approach to sort of a more prevention aspect than treatment approach. And then you said 1 to 2 million population is being looked after by the public hospital system, and we are trying to look after the other 5 million. Hopefully they don't get ill, especially with the aging population and chronic diseases. Have I got that right?
I think this is the coverage, because healthcare system, if you really just talk about treatment-based system, then you will be taking care about the other population who have no symptoms and signs. But basically, everyone, if they start to take care of their health, and then to put attentions, and whenever they need to have some intervention like screening and like vaccination. So after COVID, many people understand this concept already, because they find that if they have a right vaccination, then they will be free from the diseases or less symptoms. So there are many other vaccines which are very effective, and there's evidence that if the population start to have those vaccinations with wide coverage, it can also achieve the health impact to the general public.
Right, Dr. Pang, so another thing we've been talking about general directions. Let's be more specific. So most people will go to see a doctor when they feel unwell. They don't just go and visit them for screening. This is a general habit. They usually go to their own doctors. If my eye has problem, they go to their own ophthalmologist. Their heart, they go to the cardiologist. What are you saying? Are you saying that from now on, we don't see them anymore, but just going to see the primary care doctors?
Yeah, it's better to see, like, even you have no symptoms, you can take the preventive advices from them. For example, say if you really wonder what sort of vaccination you should receive, not only about the subsidized vaccination program, you can be talking about some like for shingles vaccines, I can say, or about some other vaccination which is also help in the older people, like pneumococcal vaccination. So those vaccines can help, and then you may need those information before you got any sick. Right, and then how about if you want to take an exercise prescription, what sort of exercise is you better to have? So you can see doctors to see whether these advices can be given even though you have no symptoms.
Right, so basically everything is prevention, prevention, prevention.
Yeah.
Right, and you had a chronic disease co-care scheme that you had, and it covers mainly only hypertension and diabetes.
Right.
What if some other diseases, when will it be covered?
Yeah. We take the diabetes and hypertension is the first step to try the co-care program, because chronic disease management is not just patient who had the diagnosis. Many diseases start at the early stage, like diabetes. They have pre-diabetes, which can start the active lifestyle modification. Some medication can control it to prevent it from to become to have diabetes. So at the moment, the system had no access, actually, based in public sectors, for the people to go get advice and also start treatments. So what we try to see whether people can have, start the chronic disease management concepts. Hypertension and diabetes, if at a very early stage, is mainly a sort of prevention. It's not a treatment in that sense. So we don't want to see the patient in the hospital with stroke, ischemia, heart disease, or renal failure, and because those will have a very significant symptoms. But most people, when they have started hypertension, they don't have symptoms at all. Can we start the detection at very early stage and start some treatment, even though they don't have much symptoms?
Right, Dr. Peng, I must stop you here because I'm sure the viewer is going to ask you.
Yeah.
You're asking me to go for prevention rather than going to the hospitals. Yeah. You're asking me not to see my doctors right away, but see the prevention first, which means very well. Doesn't mean that we have to shoulder our own medical expenses because, as I said to you before the show, I said, I'm sure some of us who bring our parents to the hospital will know that you pay a very basic fee, and then all the medicine you took away will be in a quite big bag that you know is definitely way below the cost that you're paying. But when you go to a private doctor, they have to charge you a reasonable fee, and that amount will be definitely much bigger than the one that you get paid at the hospital. So is this the government trying to shift their burden to the citizens?
I think put it this way, because for the moment, when the person, they go to hospitals, they may not focus on the early disease. So you find that you need to have wait for a very long queue, before you see a doctors. But you can imagine if a disease, they can be treated and start the intervention at very early stage instead of waiting in the queue without any intervention.
I agree.
So,
but who's paying for it?
Yeah, that's another point. So we need to design the system to see whether we can sponsor or purchase the services from the private, and then we see at the affordable prices, and even we designing what sort of the support we can have, like laboratory support as well as the medication support. So if the whole co-care program had achieve few purpose, first is family doctors concept. Second is the affordable prices as consultation, as well as laboratory services, as well as medication for chronic treatment or intervention, I can say. So if those things are well established through purchasing, then I think if a person, they can have a choice, say whether they can have a very good services, a private with long relationship with the family doctors, and then they get advisors not only at chronic disease, they can also get advisors from other preventive care. So that if this system is well established, then compared with GOPD or specialist center, they mainly provide medical intervention. And they won't have doctors who are looking after you to understand you, including your family, including your future potential risks. They mainly see what disease you have and they treat that. So I think in longer term, this system would take up more, the effect on the health of the whole general population.
Right. Thank you for reassuring the viewers that the government will consider some subsidy in terms of laboratory or even medication. I think that's one way to get the whole system started. I think I can see your intention. Can we say that just in case, if some have more serious illnesses, that the primary or family doctors will be able to refer them back to the specialist?
Yeah, that's the one, also the way we need to explore with the current system, because nowadays we see the doctors refer the patient directly to secondary care and then tertiary care. But if we have family doctors, we can have some sort of arrangement, see whether we can have some sort of special access, and then return the patient back to family doctors in case the patient can be managed as primary health care. But of course, if the disease, some disease gradually deteriorates up to the specialist level, then there could be some collaboration between family doctors and specialists.
Right. Dr. Peng, there's another thing I want to ask you about the enhanced elderly healthcare voucher. I mean, how can the elderly get that extra $500? I mean, how can they spend? Can they just spend on medical services, or, as you said, Chinese medicine or dental services? Can they use that over there as well?
Yeah, the elderly health vouchers, the whole purpose is to encourage the people to seek preventive care. Right. So, but you understand that we also think that the patient choice is also important. But in order to encourage people to spend more time in the preventive care. The new design of the additional $500 is that when a person spends $1,000 on the preventive care, no matter it's Western medicine, Chinese medicine, or dental services. So if they have that sort of the services, already spent on them, they can have additional.
One question.
Yeah.
People also ask, right, I've been going to the hospital, and how about my personal healthcare record? Can they be transferred to the family doctors?
Yeah, that's a very key question, because now we spend a lot of study and try to enhance the e-health system. Now we promulgate in the both public and private. We understand that the one health, one record, one person, one record is critically important for the communication, especially between the primary care and the secondary care.
Right.
Yeah, so this is the one target we need to achieve.
Right. Also, I saw that on your list, there are over 6,000 family doctors in Hong Kong, and there's around, say, 2,700 are registered. So do we have enough doctors, just in case everybody goes to the system and support your initiative?
I think we really need time to have to achieve two things. Firstly, the general public accept the family doctors to take care of their general health. Second is that our doctors, they would take up more role on preventive care as a long-term relationship built with their patients. So we will develop system, allow those registration like other countries they try to develop. And so this is one thing. Another is try to provide incentives provide to the private.
Dr. Peng, I'm going to ask you the last question before the show ends. CE said that it's going to take 10 years to change a culture from treatment-based to more prevention, which you have explained why we need that. What type of KPI, key performance index, will you put to this system to say that you're successful? Because 10 years is a long time. I mean, a lot of people will say, well, I'm already 80 years old. So how will you answer my direct question? What is your KPI that you're succccessful?
Okay.
Sorry to be so direct.
Maybe for KPI we really need some time study, but I really expect one thing happen is once the time the patient go to emergency department and the professional say, who is your family doctor? And that would be really the true success of the primary healthcare system.
Dr. Peng, thank you for a very direct answer. We want to thank Stephen for sharing the government's blueprint for reforming our healthcare system. This seems to be a step in the right direction with our aging population and increase in chronic disease. We will all need to embrace this change to reap the benefits for our future. Have a good week and good night.